evening, everyone, and thank you so much for joining us tonight. Before we get started, I would like to read the brief disclaimer that you can see on your screen. The PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, I would like to introduce myself. My name is Craig Orpello, and I will be your host tonight. Thank you so much for joining us for another PharmAssist virtual learning experience. It's a live educational program created exclusively by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your own home. The PharmAssist program takes place every Monday night at 7 p.m. EST or EDT. Tonight, we will be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A throughout the program. And those products tonight are Menopur, Gonol-F multi-dose vial, and Avadrill. And you can join us via Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format. And that is how we allow you to interact throughout the program. You can share your questions right into the chat, or you can share them directly in the Q&A section if you're joining us via Zoom. As always, we are joined by various amazing HCPs each week from across the nation to provide you with those real-world experiences, just as if you were sitting across the table from them in their clinic. And tonight we are joined by Karen Hammond. So I want to thank you so much for your time and interest this evening. And now I would like to turn it over to Karen. Take it away, Karen.
Thank you, Craig, and hello to everybody. Thanks for joining us this Monday night. I hope you've had a good start to your week so far, and I hope we're going to make it a little better even. So as Craig said, we're going to talk about 3 different medications. Every Monday night when we do this, there are various providers that will come on and chat with you about different medications. And tonight, I am going to talk with you about Menopur, Gonol-F multi-dose vial, and Avadrill. You may be prescribed all of these or none of these, but I'll give you a little hint. If you want to stay on and keep watching, if you've not been prescribed these medicines, the injections are actually given just the same. So it may be worthwhile just to take a look and see how these injections are actually administered. So as Craig said, I'm Karen Hammond. I am a doctor of nursing practice and a nurse practitioner in Birmingham, Alabama. And I have been doing this now for, a little over 36 years. So a lot has changed in my time doing this, and it's all for the better. And hopefully it's going to make these injections very easy for you to do. Everything is so streamlined and so much easier than they were even 20 or 30 years ago. And the medicines we're talking about tonight can all be given just in the fatty part of your belly. Or you can give them in the muscle, either one, but all of them are safe to give in the fatty part of your belly. I'm going to talk to you about these medicines. We'll show a video, and then I'll answer your questions on the other side of it. So think about your questions, and don't worry if you don't get to ask them right away. We'll have plenty of time throughout the course of the evening to address any kind of questions or concerns that you might have. Also, keep in mind that the awesome people at Mandel's Clinical Pharmacy, as well as your awesome providers, are always going to be happy to talk with you about any questions that you have. The information I give you is going to be general, but always rely on your healthcare professionals to tell you exactly what is best for you. So with that being said, I'll move on to our first product. And the first product we're going to talk to you about tonight is Menopur. Menopur contains hormones that will encourage your ovaries to grow eggs. It has 2 hormones in it, both FSH, follicle stimulating hormone, that many of the other fertility injections will contain, but it also contains another hormone called luteinizing hormone. So for some patients, this mixture of medicines is going to be the best thing to stimulate your ovaries. This one does require that you do a little mixing, but it's not a big science project, so don't worry about that. And then, as I said earlier, the injection is just given in the fatty part of your belly or the back of your arm or your thigh. So Craig, if you'll go ahead and start the video, and then we'll answer some questions. I'd like to talk with you about administering Menopur. If your prescriber has recommended that you take Menopur, it's given subcutaneously, which means in the fatty part of your skin. You can either generally give it in your lower abdomen or in your outer thigh. It's quite easy to mix it. It does take a few steps though. You need to start by taking a look at what your dosage is. Each bottle of the powder of Menopur contains 75 international units. So if you have been prescribed 150 units, you will need 2 vials of the powder. No matter how many vials of powder you'll still just use 1 cc of the liquid. So I like to start by opening up the tops from all of the bottles. So we're going to do a demonstration today for 150 units. So you'll need, again, 2 powders, and you just lift the top up of the vial of both powders. It actually just lifts up really easily. And then lift off the top of one of the liquids. The liquids are just a way to dissolve the powder. There's no medication in here. It's important you use this liquid, but don't worry, you'll probably have some liquids left over. The next step is to take a Q cap. You may not have ever seen one of these before, but you just open up the package, and there's a little device that's in here that will just slip right onto the top of the ampule of the vial. So take the vial of liquid and just snap the Q cap right on top, just like that. Next, you'll take a syringe that will be provided with your medications, and it just screws right on top of the Q cap. Then the pretty cool part begins. Just draw back about a cc of liquid. If you get some air in there, that's okay. We'll have plenty of time to get that out. Once you get the liquid into the syringe, take off the syringe and the Q cap as 1 unit, and that has all of the liquid that you'll need. Next, you'll take the first vial of powder, attach the Q cap, squirt in all of the liquid, swirl it around a little bit, but it dissolves very quickly. Turn it upside down and withdraw that mixture. Now you have 75 units in the liquid in the syringe. Then take the Q cap and the syringe off as a single unit again, and put it on to the second powder. And it just snaps right on. Squirt in the liquid, swirl it around a little bit to make sure it's all dissolved, and then draw up that mixture. After that's in there, you have both of the ampules of powder, the vials of powder, in the syringe. Just unscrew it, and you're ready to put a needle on the top of it. And you can just take the tiny little needle right out of the package, and similarly, it'll just screw right on the tip of the syringe. And it's ready to give. When you give this injection, you might first want to take an alcohol pad and just swab the area that you want to give the injection. Then take the needle off, take the cup off the needle, bunch up the tissue, insert the needle straight in all the way, and then just push the medicine in. Release the plunger, wait a couple seconds, pull the needle straight out. If you need to, you can wipe the area with the alcohol prep and apply a bandage if you have a little bit of bleeding. But just like that, you've given your injection of Menopur. So how easy was that? You can just take out all the supplies when it's time to do your injection, and you can just mix it right along with me. So it's quite simple to do, just a few steps to do. The first time you do it will be the hardest time, just because it's different, and you're gonna just want to make sure you don't make mistakes and how is it going to feel putting the needle through the stopper of each vial. But after you've done it once, you'll be ready to teach the other ladies in the waiting room how to do it. So let's start out by asking hearing what questions y'all have, and then we'll have a little more discussion. Craig, do we have some questions?
Yes, we do. How's it going, Karen? All right.
Going great.
So we
Good to
have
see
a couple
you.
of questions. Good to see you as well. So we have a couple of questions coming in. So let's see. One of them, oftentimes people want to prepare themselves for the potential side effects. They want to just know what's there. And that's part of what this program is for, is get out ahead of that so you know what to expect beforehand so you don't have to worry about it later. So the question came in a couple times where people are just want to get a little bit more of a grasp on some of the biggest side effects that they can expect that are associated with Menopur, and maybe some of the different ways that you can either get ahead of those, or if you do have them, how to treat them after the fact.
Perfect. Those are all very good questions, and I'm glad you asked that. The biggest side effect is it may sting a little bit. Some people, they don't feel it at all, but it is an injection. So you may feel just a little bit of a sting or burning when you give the injection, but it goes away pretty much immediately if you do feel something. More than a side effect that you can experience is really the way the drug works. It causes your ovaries. It's the hormone that your brains would normally make that work right on your ovaries to develop and grow and mature your ovarian follicles, which contain the eggs. So when you're stimulating your ovaries with this medicine or some other medicines, it can cause your ovaries to get bigger because the follicles that are growing the eggs get bigger. Oftentimes when you're undergoing this kind of treatment, the goal may be for in vitro fertilization. And if that's the case, the goal is going to be to get more than just 1 or 2 eggs. So when you take this medicine, you can have lots of eggs to develop. So depending on your dosage and your treatment plans, your provider is going to tell you a little bit about what kind of response he or she would want you to have. So if your ovaries are getting bigger, they may feel a little bit more uncomfortable. So those kind of feelings are being bloated, your genes don't snap together quite as easily, or just an increased awareness when you're walking around. It may feel like your ovaries are moving around a little bit, kind of like if you've on an empty stomach and you drink a big glass of water, it may feel like the water is kind of jiggling around in your belly. That's going to be the way your ovaries feel. On occasion, the ovaries get really big. And if that happens, then your ovaries can become painful. If that does happen, you should contact your healthcare provider, let them know. They are going to want to do everything they can to get the response that they desire, but also to keep you comfortable and to keep you safe and healthy. That's why you're going to have monitoring visits when you take this medicine. It's likely that your provider is going to want to do some fairly frequent ultrasounds and maybe some blood tests just to see how you're responding. So you hopefully won't over-respond. The dose of medicine can vary from patient to patient. A question that I commonly get is from patients in the waiting room saying, oh, why am I getting 150 units, but the lady next to me was getting 450 units? And if that's the case, it's because your treatment's different than what the other patient's is. Every patient is treated as an individual. So just because we expect you to respond on a certain dosage doesn't mean that's the dosage that everybody will respond to. So it depends on each person's unique history and treatment conditions and situations. So basically the side effects to Menopur are very low, but they're going to want to keep an eye on you as you're taking these medicines just to try to curtail the risk of having great side effects.
Perfect. Thank you so much, Karen. I know that's a lot of times people, that the big benefit of the PharmAssist program, like we mentioned before, is getting some of those jitters out of the way now so that you can be prepared when it comes. And that's really what we're here for. What we're trying to do working together is allow you to ask those questions maybe you didn't get a chance to ask when you were last in the clinic or speaking to your nurse, or maybe it's something that popped up and you're getting ready to give that shot and you want to be prepared. So great question, great answer. And let's see, we have a couple other questions coming in right now. So there is one, and you touched on this a little bit when you talked about what Menopur is exactly. But this question comes in quite often, and I think it gets a little bit confusing for people who, some people go on to FSH, some people go on to Menopur, and there's different ways you can do combo treatments and so forth. So the question is, what's the difference between using FSH alone versus Menopur? Why would you use one versus the other in a given fertility cycle? So if you could just maybe elaborate a little bit more on that for somebody who is looking just to get a good understanding of why they're on one medication versus another.
Absolutely. Great question. And that kind of points back to what I said earlier, is that every patient is unique and hopefully will be treated as such. Most of the time, I personally don't think it really matters if you're taking FSH or an HMG, which is Menopur. That's the only commercially available HMG in the United States. But I don't think that it really matters for most patients. However, if you are taking a drug like Lupron, that's going to slow down your hormone production, you may not make enough of that FSH, the FSH or the LH. So by giving just the FSH, it may not help you have a good response if you're missing the LH. Some other medicines that might impact it would be a little bit to a lesser extent the Gnrh antagonists like ganirelix or cetrotide. A lot of providers want to add in some LH as well. So it's nice if you're going to add in LH that it's already mixed in with FSH. So that's one less medicine you have to worry about. So to that extent, keep in mind that if you've been prescribed a combination protocol where you're taking both an FSH, such as Follistim or Gonol-F, and an HMG like Menopur, then every time you take 75 units of Menopur, you're also giving 75 units of one of the FSHs. The difference is that this is a urine-derived product, a human-derived product, as opposed to a manufactured in the lab product. So again, your healthcare provider is going to tell you what's best for you, and we never mind being asked why. So if you want to know exactly why you're being given medicine, ask about it. If you have particular questions, ask about it. I even tell my patients that they should make a list of their questions. When they pop into their head, just make it in a little notepad. And when they come back to see me next time, just ask those questions. Or if it's really a burning question, give us a call, talk with us or one of our other team members, and we'll be happy to make sure you're comfortable with it. Again, it's part of the end goal that we have in mind, how we want your response to be and what your underlying conditions are. One other time that it's important that women take a drug like Menopur that has FSH and LH is for people that have very low body fat. Usually it's because they're underweight or maybe they're marathon runners. They can have a lot lower levels of LH. So we want to supplement that. So there are a number of things that we take into account when we're deciding what the best medication treatment protocol is for you. Long answer to a short question, but I'm happy to keep them coming.
Perfect. That was great. Thank you so much, Karen. So this is a little bit more of a specific question here. But question comes in because you were discussing the way that you give the shot and obviously discussing the context of utilizing a subcutaneous injection. And a question comes in asking, is there a specific area of the thigh that you recommend more than others, whether it be for quality of the shot versus obviously reducing pain and so forth, reducing potential side effects? So just get a little bit more preparation when they're getting ready for that first shot.
Absolutely. Anywhere that you can pinch an inch is probably okay to give your injection because it's going just into fatty tissue. That being said, I think the best place to give the injection is your belly. It sounds kind of weird. I know my parents always told me not to pet that stray animal because it may bite me and give me rabies and I'd have to get shots in my belly for a month. And so that scared me or tried to scare me from petting stray animals or an animal I didn't know. But actually there aren't quite so many nerve endings just in your belly. And that's a part of your body that's not as exposed to the sun and the elements as other parts of our bodies. And even really, really skinny people, if they lean back and then kind of push their abdomen forward, they're going to have a little bit of a place they can pinch an itch. So that's generally my preferred place. Two, if you have a little bruise after you give the injection, nobody's going to see it unless it's swimsuit season and you're braver than me and wear a little tiny bathing suit. If you want to give it in the back of your arm, I tell people just to lean the back of their arm up against a chair or a table, and then just go back in the very back fatty part of the arm where you can pinch an itch. Or if you want to do it in your thigh, which is also a reasonable place. I have a lot of people that prefer to do that before they've given an injection. That if you stand up and just kind of put your hand down to your side, right where your hand ends up on the outside part of your leg is where you can give it. So it's not quite straight down the middle of the front of your leg or not quite straight down the side, but it's a little bit between the front and the side, just to the side of the top of your leg, and then just pinch an itch and put the needle straight in all the way. It's very forgiving. The needle is tiny. It's going to be a 1/2 inch or 5/8 of an inch. So it's a little teeny tiny needle. And if you pinched an inch, then it's going to have plenty of room to be able to give the injection.
Perfect. Thank you. I'm not going to lie, you actually scared me a little bit talking about the rabies injections in your stomach for a month. So, oh man, this seems like nothing compared to that. So look at that. Anyone that was nervous, we just gave you, it could be way worse, right? So great. All right. Perfect. So the next question, speaking of things that could scare people, we always get this question for almost every single product, and it comes to the potential of, what if I make a mistake, right? You've answered this question a million times as well, and just as many times probably in your clinic as well. But the idea of people want to know, prepare again for the worst so that you can plan for the best, right? So the question is,
right.
What do I do if I make a mistake when I'm mixing my Menopur? So I guess we can take it as two different ways, separate. First, like just if you make a mistake mixing, how do you handle that before you give the injection? And let's say after the fact, you've already given the injection, you realize, oh no, I did something wrong. How do you handle that? Maybe we can give a 2-for-1 with this question.
Perfect. So this medicine, it's a little bit hard to make a mistake doing it, even though there are lots of steps. But a couple of the things that I've seen people do, one is they take 1 vial of the powder and mix it with a liquid, and then they take a second bottle if they're prescribed to and mix it with a liquid. Now they've got twice as much liquid as they really need. I think if you do that, if you use too much liquid, that's a lot of liquid to put into fat. You might need to give it in 2 injections. Another thing I've had people do is draw up the liquid and forget to mix in the powder. If that happens, if you've already given the medicine, if you already gave just the liquid, then you're going to have to take another shot that has the powder mixed in it. So a couple of things that can go wrong. If you take too little or too much for just 1 injection, it's going to be pretty forgiving. I really think the time that people get confused is when you're taking multiple medications. So if you are taking Lupron or one of the Gnrh Antagonists, Cetrotide or Ganirelix, if you're taking that and you're taking FSH, you're taking Menopur, you might be taking some supplements, it can be really intimidating and kind of scary. In those cases, I recommend that you do things like what I do and just set everything out all at once and say, okay, first I know I'm going to need this medication. Here are all the supplies. I'm only going to focus on this one. Do it first. And the same thing with each medicine that you're taking. If you take way too much, if you get a little overzealous and you mix up 6 powders and you're only supposed to take 2, we wouldn't want you to take that. But then again, if you've already taken it, you should probably notify your healthcare provider, say, look, I think I took too much of this one. Since this one has to be mixed, it's pretty easy to take the exact dose to make sure that you're doing it right. It's a lot of extra mixing to take 6 over 2. So I think that's very unlikely to happen. I think probably the most common thing that I see is people using too much liquid. It's not going to hurt you to take that much liquid. It may sting a little bit more. So I like for patients to keep it around a cc, maybe a cc and a half at the most, to give it subcutaneously.
That's great. I think anytime we can let people know, if you make a mistake, it might sting a little bit more, then you have a vested interest in making sure that you don't accidentally make that mistake because it'll get you. So that's great. Thank you so much. That's a perfect answer. And I think that's the kind of thing that we are really trying to drive home with the PharmAssist program is those types of questions you can ask now, get out all the jitters, get out all the, all the little potential things that you're worried about that you might make a mistake, so that when that day comes to pull that first needle out and give yourself that injection, you've already gotten all the mistakes out of your way in your head so that you don't make them into your body. So great. So thank you so much.
Sure.
Looks like we're all good right now with questions on Menopur. So one thing, as always, what we like to do is I'll give people another like 30 seconds or so. If you have a question or that answer sparked a question in your head that you're trying to furiously type into your keyboard or on your phone, as we get ready to move on to the next product. So in the meantime, I'll throw it back over to you, Karen, and anything else you want to share before we check for those questions, and then move on to the second product tonight.
Perfect. Thank you. So as I said, the first injection is always the hardest because it's a little bit unfamiliar. Most providers have like a little practice kit in their office and will demonstrate exactly how to do it. There are lots of resources available for you, including the PharmAssist program. You can go on mymandels.com and find the links to not just me showing how to do it, but several different providers showing how to do this injection. And maybe you'll pick up a tip from one of us that you didn't from me. So it's worthwhile just to look at that. There are lots of YouTube videos, but keep in mind, anybody can post anything on YouTube. So I think tuning into a PharmAssist program or looking back in the archives at mymandelsPharmacy.com is your best bet to make sure you're getting information directly from a healthcare provider. And always ask your provider if you're still uncomfortable. Just let them know. I've had lots of patients come in and say, can I just come in and you watch me do my very first dosage? And of course you can. We're happy to do that. Everybody has your best interest at heart, from people like myself who are watching from afar, to the pharmacy, to your doctors, your nurses, the embryologists, the whole healthcare team wants you to succeed. And the only people that want you to be pregnant as much as you yourself do are probably the people that are on your team. So we want to make it easy for you, and we want to have information accessible and readily available for you. You can also just pick up the phone and call them at Mandels and tell them that you're just a little bit nervous about how to do it, and they can answer any of your questions as well. They've got a phenomenal team to help you out. So Craig, did we get any other questions?
Looks like we are all good. We're caught up on questions. We'd like to remind everyone at this time that no problem. If you think of a question later on, you want to go back to Menopur, you have a question, even though we've moved on, we can answer questions about any of the products. And we will also have time at the end to ask any questions about anything at all that might be on your mind, whether it's 3 products, general fertility questions or infertility questions, and any of that you can bring up. So have no fear, you'll have plenty of time to ask your questions, but at this time we are ready to move on to the second product tonight.
Perfect, thank you. So the next product that we're going to talk about is the Gonol-F multi-dose vial. So there are a few reasons that you may be prescribed this. Gonol-F is just FSH. Remember when we talked about Menopur, it was FSH and LH. This is just FSH, follicle stimulating hormone. It's one of the few hormones in our bodies that does what it says it's going to do. It stimulates follicles in your ovaries to grow. For the FSH, it can be given in pen form, it can be given in little individual vials, or it can be given in this multi-dose vial. This particular medication is given subcutaneously, just like the Menopur is, and it's very easy to do, very easy to mix. So let's take a look at the video and then we'll talk about it a little bit more. So you want to load that up, Craig? Your prescriber has recommended you take Gonol-F multi-dose. It'll come to you in a box like this that has all of the things that you'll need to give your injection. I'd recommend you begin by choosing your injection site. This medication is administered subcutaneously, which means it goes into the fatty tissue of either your abdomen or your outer thigh. I generally recommend people take it beneath their belly button, outside an inch or 2, beneath and out, or in the outer part of the thigh. Really, this medication can be administered pretty much any place on your abdomen or your thigh where you can pinch an inch just to make sure that it goes into the fatty tissue. Next, open up the box, and the inside will look like this, where there are syringes with needles already attached, a syringe with liquid, and a vial that has powder in it. The powder is actually the medication. To give the injection, just open up the packaging, remove the vial and the syringe with fluid, and take out just one of the syringes that has the needle already attached. Next, you'll remove just the top off the vial by gently lifting it up. Then take the top off the needle that's attached to the syringe with the liquid in it. Put it into the middle part of the vial, into the rubber stopper, and push in all of the liquid. And it will quickly dissolve all the powder that's at the bottom. Remove that syringe and discard this into your sharps container to avoid injury later on. Then you can open up the needle and syringe. Remove the cap from the needle, and again place the needle into the midpoint of the stopper. And you're ready to withdraw your medication. Your prescriber will tell you exactly what dosage is best for you. But for today's instruction, I'm going to suggest that your dose is 150 milligrams, 150 international units. You just pull back to 150 on the syringe. If there's a little air in there, no worries. And it's ready to administer. Then you want to choose a place on your abdomen to give the injection. Wipe it one time with alcohol and bunch the tissue up. Remember, you want to pinch an inch. Then take the needle, put it straight into that area all the way. Push the medicine right in. Release the skin, release the plunger, and pull the needle straight out. If you notice a little droplet of fluid or blood on the area where you administer the injection, no worries, just wipe it with an alcohol pad and cover it with a bandage if you need to. When it's time for your next injection, you'll do the same thing, but the reconstitution is already done. You'll simply just take the vial, withdraw the same amount that has been prescribed for you, and administer it just like you did before. Some people opt to alternate sides or sites when you're giving the injections. Keep in mind that the vials and the multi-dose Gonol-F are overfilled, so you'll have more medication than what's actually printed on the bottle. Don't waste that medication, you can still use it. If you have any questions, you can always ask your healthcare provider. But congratulations, you've now given your Gonol-F injection. That one is pretty easy. The mixing's a lot more simple to do. So one of the questions I get about this medication is, what if you need more than 450 units? That's a really easy one because you may be prescribed more than one vial. But the really good thing is these vials are overfilled. So there's more in there than what it says on the box. So the box may say 450 units, but there's really going to be about 600. So they're overfilled by about 150 units. It's important for you to know that, not just because if you're a bargain shopper like me, you want to make sure that you do this as affordably as possible. But also it's important to know because you don't want to draw out that third injection if you're taking 150 and saying, gosh, there's still so much left in there. What did I do wrong? It's overfilled because each time you may notice like a little drop come out of the tip of the needle or out of the tip of the vial, and the manufacturer needs to be absolutely certain you're going to get the amount that you need. Another question that we commonly get is, what if you have still 150 in there and you need, you're taking 225 a day, you need 75 more. You're probably going to have another pen that's been another multi-dose vial that's been prescribed. So just reconstitute it, drop 150 out of the second one, and then draw or out of the first one that you used, and then draw out another 75. It's really easy because the syringe has the units on there, so you don't have to worry about cc's or different numbers like that. You just have to remember your dosage. So Craig, what questions do you have for me?
All right, perfect. So we have a couple of questions. I think this first one came from somebody who just listened to the Menopur section and said, that was a great question. I want to ask it about Gonol-F. So it says, what do I do if I make a mistake and I inject too much of my Gonol-F?
Okay, that's great. And I'm glad you asked it about this medication too, because I think it's actually a little bit easier to make a mistake with this one. With the other one, there's a lot of mixing involved, and so you'll set out your powders and your liquids and everything at the beginning. But this one, if it's already mixed up, you want to make sure you're taking just the right dosage. When you take the injection, you're just going to draw up into the syringe the exact amount that's been recommended for you or ordered for you by your provider. So if it's 150, 225, 300, whatever it is, you're just going to pull back on the syringe to get that much liquid in there. I think it would be hard for you to take just the liquid of this medicine because it's in a syringe of its own. If you did, you'd probably take the whole thing, and that's not going to hurt anything. You're just going to need some liquid to dissolve the powder. It's really, if you just pay attention to what the dosage is, it's going to be hard to make a big difference. Now, I don't want you to spend a huge amount of time just looking to make sure it's exactly on the 150, if that's your dosage, to make sure that it's not just a little teeny speck just right above or below, or to make sure all the air bubbles are out, because y'all have heard me say before probably that only on soap operas is it sudden death when you get a little air into an injection. You can give a whole syringe full of air and you're not going to have any problems. Don't do it, but nobody wants to stick themselves in extra time. If there's some little air bubbles in there, you can tap the top of it to get them out, or pull the plunger back on the syringe and then push it up, making sure that you don't get the liquid dripping out the top, and that'll help remove any air bubbles. But if you got a couple of tiny little ones in there, it doesn't matter. It's hard to make a mistake with most of these medicines. And as long as you pay close attention to what your dosage is, I think you're going to do just great with this and not have any problems at all.
Perfect. Thank you so much. And I can only imagine that there were tons of people who were in the middle of typing a question about the air bubble being sudden death, and immediately just deleted their question as you answered that. So thank you for getting out ahead of that one, because we do get that quite often. Let's see, we do have a question, a little bit of, that's a little bit more in-depth answer regarding the overfill that you discussed. You talked a little bit about that before, and that's a huge, we get that question all the time about how the overfill works. And
Craig, you're sounding a little like Darth Vader. I'm having a hard time understanding. I don't know if that's my connection because we're in a thunderstorm, or if that's the real thing.
On my Darth Vader voice filter for this program. I'm sorry. Can you hear me any better now? Is it coming through better?
It's still a little Darth Vader, but I can understand you better.
I mean, if I can sound like Craig, Vader's not terrible. So I'm a big fan. So we'll see. We'll try to power through. The internet is having some fun with us tonight. So hopefully you'll be able to see what happens. But let me know if you have any trouble understanding. Obviously, anyone in the chat, feel free to let us know as well. I do apologize for that. But the question is regarding overfill. And the question is, you mentioned the overfill as regards to the 450. Does it work with the 450? Does it exist in other vials as well? Just to get a better understanding of how that works.
Perfect. Most of these medications do have some overfill. The Menopur is not, because it's single little vials of each of them. And the others that come in single little vials won't have overfill in it. But if you're taking this or either of the pens, there's going to be some overfill. Now, I found that it's pretty reliable that you're going to have at least 100 units of overfill, no matter if you use the Gonol-F multi-dose, the Gonol-F pen, or the Follistim pen. Just want to make sure that you're not going to run behind on your medicine. With the Gonol-F multi-dose, you can count on 150. is my experience. If you think you might try to stretch out a little more than that, I wouldn't bank on it. So they all are going to have some overfill if it's a multi-dose vial or a pen, and take advantage of it. Use that medicine, but you may want to not get down to the very end of it and just hope you have enough. So in that case, make sure that you have all of your medicines. Once you get your shipment from Mandel's, you want to take a look and make sure that everything that you need has come in your big box. And if you have questions, it can be overwhelming when you first open that box. Talk to your provider, or certainly talk with the folks at Mandel's. A lot of my patients will bring in the entire box with them when they come in for their baseline visit, just so I or one of my team members can go through everything that's in there and help them sort things out. But I think you'll find with Mandel's, everything is going to be properly labeled. This needle goes with this syringe and this medicine. So it's going to be really simple for you. Nevertheless, if you have any questions about it, if you think you might be running low, try to call the day before that you're going to need that medicine, to make sure that there's plenty of time to have that medicine sent to you. I know in the summertime, shipping is not generally an issue, but in the wintertime, it definitely can be. So you want to make sure there are not problems with that. And at least in most parts of the country, there aren't fertility pharmacies right around the corner that you can just go pick it up at 9:30 at night. So we don't want you to be into a situation where you don't quite have enough medicines and you need them for that particular injection.
Perfect. Thank you. Just checking, do I still sound like I'm trying to convert you to the dark side? Or
It does.
Oh, this is going to be fun. All right. I'll try to get right to the question. So we'll see if you can hear this. So question comes in. This is just from your own personal experience. They're wondering, do you typically recommend the vial over the pen, or vice versa in your practice? And why or why not?
I really don't think it matters. A lot of times insurance will dictate which medicine it will be prescribed for you. Some insurance companies have strict rules. They'll only cover either Gonol-F or Follistim, but not both. So we have to rely a lot on what the insurance says. I think all these medicines work exactly the same. I'm not worried about using them interchangeably at all. And the good folks at Mandel's will do insurance benefits and see if your insurance will cover one or the other, or if it needs to go to a different pharmacy. And they're awesome about forwarding the prescription to a pharmacy where you might have insurance coverage if you don't through Mandel's. So I don't think there's a preference of one over the other. There's a stimulation protocol that I use that one Gonol-F multi-dose will be enough for a cycle. In that case, I recommend they get that, just because that's going to be just the right amount of medication that you need. I would ask your healthcare provider which they think is best for you. You may also want to take a look at the other videos and see how the pens work and see which one you feel comfortable with. And if there's a preference that you have, you may want to mention that to your provider, because we want to make this easy for you, want to make it comfortable for you. And if you think you may be more familiar or comfortable doing it one way or the other, then we can certainly make adjustments to your protocol.
Perfect. Thank you very much. That's great for people to understand just the general why you go on certain products. And I think a lot of times because there are so many out there, people are wondering which one's better than that, or why did I go on this one? And a friend of mine or my family member's sister went on that one, something like that. So thank you for that great answer. It really helps people feel comfortable with the decisions that are being made. And as always, we heard it already many times, but we often say, take some of these questions back to your clinic and ask them. And so that's a great question that you can ask when you do speak with your nurse, to get an understanding why they chose one versus the other. And if it puts your mind at ease, all the better. I'm sure they'd be happy to share that information with you.
Absolutely.
Perfect.
Absolutely.
So, next question is very simple. This is an easy one. It's just about keeping track of the medication. How do you store it? And in this case, we're wondering, with the multiple vial, what do I do with the vial if I need to travel or I go on?
Okay, that's a great question. And, we're getting a little bit closer to safe travel these days and closer to travel season. So people may need to take their medications places, and it's perfectly fine to do. With all of these medicines, you want to keep them at kind of a low or low normal temperature. If it's in your house, you can just keep this out on your counter. When you get this medication, it will not be refrigerated, and it doesn't need to be refrigerated. So you can just keep it kind of at room temperature. Once you mix it, you can just leave the mixed vial on your counter in a safe place, wherever you're going to be doing your injections. It doesn't have to go back in the refrigerator. However, it does need to be used within 30 days of the time that you first mix it. So if you mix it and you have some left over, it's probably going to be discarded if you want to wait and see if you have another cycle, or wait till later on, or give it to a friend or whatever. Then it's not going to be good unless you use it within 30 days. It's not going to hurt you, most likely, to take it, but it may not help you either. The drug potency doesn't stay the same, and you don't want to take any chances. You get to this point, you want everything to be perfect. So it does not have to be refrigerated.
Perfect. And that actually was great, those last two questions in a combo, when you talk about recommending a vial over the pen and all of that, and then taking into account travel. As Karen mentioned, as we're getting closer to, not only are more people just in general starting to be able to travel now, but we're getting closer to the warmer months. And that is one of the things we hear quite often, is clinics try to use some of the vials when possible for patients, just because of the fact that things don't need to be refrigerated, both in shipping as well as, if you're taking something with you. So it's something to keep in mind as we get closer to that month. It might be something people might want to bring up with their clinic, as you're just kind of getting a feel for which medications you're using. So excellent. And that seems to be the questions as of right now. So again, let's give another 30 seconds or so in case people have any questions, and then we can get ready to move on to our third and final product of the evening.
Perfect. So again, just to elaborate a little bit more on travel, people ask me all the time, what if I'm going to be on an airplane? Do I need to put this in checked bags? Will I be able to travel through the TSA with needles and medicines? Are they going to confiscate it? I never recommend people put medications in checked bags, because checked bags don't always end up where they're supposed to. My husband had a bag that he checked when we went to LA a few years ago. We've never seen it. It's never resurfaced. So I don't trust it. I don't want you to miss taking your medicine, miss a dosage, or miss all of it, or lose the medicine, relying on checked bags. I tell patients that if they just put it in one of the baggies that your medicines will come in, like your needles or syringes, that has your name on it, and put that in a separate, take it out of your bag when you put it through TSA, just like you would your liquids, and just let it go through there. I've never had a patient to have a problem. I traveled once with someone that was on an injectable blood thinner, and he was able to just take that out, put it on the conveyor belt with the rest of his liquids, and had no problems at all. If you want, you can always ask your provider for a note to take with you. If you're traveling by car, I would recommend you just keep it in your purse, and keep your purse with you. You don't have to put it on ice or anything, but make sure that it doesn't get too hot by leaving it in the car, or too cold. You don't want it to freeze either. So just try to keep that at a comfortable room temperature, or maybe a little bit below. So I hope that answered all your questions on the Gonol-F multi-dose vial. It's a great product, and as you saw, it's really easy to administer. The last product that I'm going to talk with you tonight is called Avadrill. Avadrill is often called a trigger shot, or HCG. It's a little bit different from some of the other HCGs, and we'll talk about that. This one's made in the lab, where the other is a human-derived product. This one is made to be given sub-Q, so it's really easy to do. So Craig, if you'll load up the video, we'll take a look and see how to mix and administer it, and then we'll talk about what questions you have. I'd like to talk to you about administering Avadrill. If your prescriber has recommended you take Avadrill, chances are you were told to take it at a very specific time. Good news, it's very easy to give this injection. The Avadrill comes in a little package like this, and you simply open it up and remove the inside part like that. Fortunately, with this medicine, it's in a pre-filled syringe. So the medication is already drawn up, mixed, and ready to administer. You just pull the plastic tab off and then choose the site that you want to give the injection. Since this is a subcutaneous injection, that means it goes into the fat. Most people recommend that you take it beneath the belly button, out to the side an inch or two and down an inch or two, or either in the outer thigh. Once you select the site to give the injection, you can use an alcohol prep just to gently wipe the area. So you bunch up the tissue, wipe the area once with an alcohol prep, remove the top from the syringe, and then put the needle straight in, all the way, depress the plunger, release the tissue, release the plunger, pull the needle straight out. Afterwards, you should put the needle and syringe in its entirety directly into a sharps container to avoid getting stuck with it. Congratulations, you've now given your first injection of your Avadrill.
Gosh, that one was way easy, especially after watching the little science projects with the other ones. By the time you take this trigger shot, you will have probably taken some other injections beforehand, and that's going to make this even easier because you'll be comfortable with the injections and the administration of it. So, and the needle, so it's going to be really easy for you. This medicine, a lot of people ask me, why would they be given Avadrill over the HCG that you have to mix? This medication has been FDA approved for this purpose, and it's a newer formulation because it's made in the lab as opposed to a human derived product. So it's more pure. Most people that take this medication don't feel anything at all, no burning or stinging or irritation at the injection site. The HCG, on the other hand, can cause a little burning or stinging at the injection site, especially if you're giving it in the fatty part of your body, like in your belly or your thigh. It is also, the HCG is a little bit stronger. So if you take one shot of the Avadrill, that's 250 micrograms, that's about like taking 5,000 units of HCG. That can be one of the guiding principles as to which medication your provider recommends for you, depending on what dosage of this medicine that you need. So what does HCG do, or Avadrill, or the trigger shot? Why is it even called that? It sounds like a funny thing. Well, the trigger shot triggers your body to release the eggs. It's like, okay, everything looks perfect. We're going to pull the trigger and have you ovulate, or have the eggs do the final maturation just before an egg retrieval. So this medicine is going to be told to be given to you at a very specific time. And you should try to stick as closely to that time as you possibly can, because the procedure that you're going to have is going to be based on the time that you take your HCG. And just because those of us that work in reproductive medicine like to work pretty close to normal hours and don't want to do the middle of the night egg retrievals, we usually schedule your retrieval or your insemination and count back the appropriate number of hours. Usually it's 34 to 36 hours before that you would take the HCG. So it's important that you take it at a specific time because you don't want to ovulate too soon. If you take the medication too early, then it can cause you to release the eggs. And if you take it too late, that final maturation may not be complete. So I'm going to stop right here and see what questions we have from Craig.
Right. So
your voice is back now. You sound like Craig.
All right. I defeated
and I
Darth
didn't even
Vader.
get to. I wanted to ask you to say, "Luke, I am your father," before it went away.
Yeah, if it comes back, let me know. You can cut it into any question. I would certainly do that. For now, I've defeated the temptation of the dark side. Let's see how long that lasts. So we have a question that comes in. Okay, so how long before I give my injection do you recommend that I take it out of the fridge?
I recommend that you take it out at least a half an hour, but you can, if you've got to take it in the middle of the night, you can take it out before you go to bed. You want it to be close to room temperature because if you inject yourself with a cold medicine, you're going to feel it. So if you just let it come up to room temperature, actually once it's out of the refrigerator, you're going to give it, hopefully you're going to give it fairly soon. So if you just have to take it like at 3 a.m, just take it out before you go to bed and have everything set up so you'll be right ready to do it without any delays.
Perfect. And so there's a bit of a follow-up type question, and is wondering, what do I do if I kept it out of the refrigerator too long? How long can it be kept out before it goes quote unquote bad? Anything I need to know about that so I can make sure that I set an alarm to remind myself once I take it out?
Gosh, that's a great question. And alarms are so awesome, especially with this. And there's so many different ways we can set reminders to remember to take the medication right on time. We've got Siri and Alexa and our cell phone alarms and our regular alarms and our friends and our family. And there have actually been a few patients over the years that I was afraid they would miss it. And so I called them up and reminded them myself just so I could get a good night's sleep. You just want to try to adhere to the whatever the guidelines are as best as possible, or whatever the recommendations of your provider. Now, if you get the medication and you forget to put it in the refrigerator altogether, and you don't get to start that treatment cycle, or you don't take the HCG at all in that cycle, I would recommend that you get another prescription for it. I would not feel comfortable with you having it sitting out for even probably for a couple of weeks. I think you should not keep it unrefrigerated for more than, I would say, probably 6 hours, just to make sure that it's going to be the best strength it can be. You know, the trigger shot is the kind of the epitome of all of your medicines, because it is the final thing you take. It needs to be just right. Your follicle maturity is going to 100% depend on your taking it. If you don't take it enough of it, or if you don't take it at all, we're not going to be able to get eggs. So you hate to get to that point and not take that medicine right. So this is the time to make sure you followed all the instructions when you get your box of medicines shipped to you. When you open it up, it will clearly say this needs to be refrigerated, and just go ahead and unbox it and do everything that it says on there about refrigerating or not. And then the night that you're going to take, or the time that you're going to take the HCG, just take it out a few hours, as little as 30 minutes before you're ready to give it. But don't fret about it so much that you are setting your alarm to wake you up to take the medicine out of the refrigerator. And then setting another alarm to wake you up to remind you to take the medication. Don't fret over it that badly. Just try to be as compliant with it as you can, and I think you're going to do great.
Perfect. I think that's something that really helps people feel comfortable, because a lot of times we know there is the package insert, rules and responsibilities and all of that. And then there's the real world. And sometimes those two things don't perfectly overlay. And so we want to make sure that people understand what are the kind of pro tips out there, the things that you can know that maybe you won't find in a package insert when you fold that out to be like a treasure map in front of you with the tiny little words on it. So that's a great, really great way to put people's mind at ease. So thank you so much, Karen.
Sure.
Appreciate that. So let's see. Also, a big reminder, you did mention when you get that box and you open it up and you take everything out, one of the great things that we do at Mandel's is to make sure, to your point, Karen, that you know what products go in the refrigerator, which ones don't. So never, get that package. Treat it just like Amazon. You don't get your package of that thing that you ordered that you've been waiting for and you're very excited, and then put it off to the side and forget about it, right? You open it up right away and you get excited. And so treat the medication the same way. Open it up, see what's in there, check to make sure that everything's in there, check to make sure something isn't underneath, like some refrigerating ice or something like that, so that you accidentally, miss that it's there. We make sure you go through all of that so in advance, so you're not, just tearing through it at the last minute right before that first shot. That would be a bad move. So thank you so much, Karen, for the reminder on that as well. So let's see. You talked a little bit about the timing of this product. Obviously, Avadrill, HCG in general, the timing is much more important than it is with pretty much everything else there. the window is much tighter. So the question is, and you touched on this a little bit, but just if you can elaborate a little bit more on what happens if I do take my Avadrill too early or too late by mistake, and then kind of throwing it back to you, a personal example of, can you think of the worst situation you've had with a patient's trigger shot, and how did you end up telling them to handle it? What was the outcome?
Great question. And I think it's important that you understand this because the timing is so essential with this medication. So if you take it too early or too late, I would say by more than about an hour, I would say call your healthcare provider. If you're 15 or 20 minutes late, or early, it's no big deal. But if you're getting further and further away from that specific time, you need to definitely contact your healthcare provider, because we want the eggs to be mature but not be released, especially if you're undergoing IVF. So why would that really matter? Why would that be devastating? And what could possibly happen? Well, I can give you a few examples. I can give you lots of examples from my own experience. And that's why some patients, I will call them just to make sure that they remember to take it at the right time. I remember one patient that was several years ago who I had told her when to take her HCG, when to come in for her egg retrieval. And she looked at the instructions that I had. She was a nurse at a medical office. And she looked at that and said, oh, poor Karen, she made a mistake on the date and wanted me to take this a day and a half before the procedure instead of the day before. So she, instead of taking it 35 hours before, she wasn't even close. She was 24 hours. She took it 24 hours after that. And that made her timing poor. She was 11 hours off. And she came to the office, and I always ask people right before the retrieval, when did you take your HCG? I want to know the date and time. And she said, oh, I took it yesterday at this time. I said, yesterday or the day before? And she said, no, yesterday. You had written the day before, but I knew that couldn't possibly be right. And her follicles weren't going to be ready to have her eggs retrieved from them. So for that, she didn't call. She showed up, but I did confirm with her when she took it at the right time. And when she didn't, I sent her home and we rescheduled her procedure for the next day. Hopefully, if that happens with your provider, they can do that. It's hard to kind of work in an egg retrieval with 24 hours notice. So that is not a desired effect to have. Another thing is if somebody has taken it too long ago. I have had a patient or two in my long career who took it at the wrong time, where they took it too long ago. And by the time they were ready for the retrieval, I did an ultrasound and look, and they've already ovulated. And you can't get the eggs once they're released. You certainly can't reliably do that. So I know I've said it a dozen times, so if you want to try to take this right when it's prescribed for you. The other medicines, they may give you a window of time to take it, but this one, it's going to be a specific time, and set all those alarms to give you a reminder to do it just right. Always err on the side of contacting your provider just to see if they want to adjust your timing or do anything different if you don't take it just at the right time.
So this is one of the ones we said before on the show. Reach out to your clinic, talk to your nurse, ask them. And this is one of the ones that I love when people ask this question, because this is the one you want to drive home the most. That to reach out, if the problem does happen, reach out to your clinic to let them know, and they can share with you probably stories just like Karen did about how to handle it and what they can do, and see if there's still something they can do. But probably even more important this is the one where they tell you the exact time. If you're anything like me, you probably are within 6 feet from 35 different things that can remind you. Most of those things are not alive, but ways that can let you know whether it's a significant other, a friend, something like that, or any one of the devices that you have, your watch, your smart speakers, all that. Every single one of them. If you're somebody like me who thinks you might sleep through your time or something like that, make sure you don't, because it is very important. And that's why I love this question, because it drives that home. If there's somebody that's questioning that, might be an issue, hopefully this is the one to take very seriously, and just hopefully put yourself in a position where you don't have to make that call, because you remember Karen. It does look like, as of right now, we are caught up on questions for the Avadrill. So what we can do is, as always, we'll open it up for time if you have any questions about Avadrill, if you have any questions about the Menopur, or just general questions about your IVF journey, anything like that. Feel free to jump in right now. And in the meantime, I will turn it back over to you, Karen, if there's anything you would like to share before we get ready to wrap up the program for tonight.
Perfect. Thank you. And just so you'll know, Darth Vader has returned. The dark side has overtaken you again. But
Got it. All right, we got a chance to do it.
So I'll just kind of wrap things up. And if you have other questions, please feel free to just chime them in. If it's on Zoom, I'll be able to see it. And if it's on Facebook, then Craig will relay those questions to me. But we're all here for you. Your providers, your pharmacist, the pharmacy team, your healthcare team, as well as your friends and your close confidants that you've told that you're doing these medicines. I always think it's a good idea if you've got a family member or your spouse maybe that's going to help you with these medications and these injections. It's good to have the guys involved too, and the partners involved too, just so they can be a part of it, but also can take some of the stress and pressure off of you. I always love it when the partners come in with my patients and I'm able to talk with both of them and make sure they both feel comfortable with it. But certainly this might be a time for you and your partner or whoever might be helping you with your injections to take a look at some of the video archives we have of administering these medications, just so you'll feel 100% comfortable. And whatever anxiety you've built up over it, that's all going to go away right after you've done your first injection, and you'll be the pro that we always knew that you could be. So, Craig, do we have any other questions?
It looks like we are all good right now, so we can.
And you are back. Perfect.
All right. I don't know. This is my game now. I guess I'm going to keep alternating with Darth Vader today. So sorry for that.
That's okay.
With that being said, I guess we are ready to begin the wrap up for tonight.
Perfect. Well, y'all, I thank you so much for joining us tonight, and we want to be part of your journey. We want to help you out, and we want this to be as easy as possible. I think lots of things are all about the experience, and nobody ever hoped to have the experience of undergoing fertility treatment. But now that you know that is your way to hopefully be able to get pregnant and have that child that you've dreamed of for so long, we want to make this as positive of an experience as possible. So always feel free to reach out with questions, for assistance. No question is a bad question, except for the question that you don't ask. So take my advice and just keep a little notepad and write down questions that you have. Call the pharmacy, call your healthcare provider. We're always happy to help you with any questions that you have. We want this to be a positive experience for you, and we want it to be an easy experience for you. So if there are no other questions, I'll turn it back to Craig and he'll close us out for the night. Thank you so much for joining us.
Thank you so much, Karen, for all of your time tonight and for your expertise and your amazing questions and answers and stories and all of that. We really appreciate it. The program would be nothing without you joining us. So thank you so much for that. And just to add into Karen's point that yes, we try to we consider ourselves the trifecta of your clinic, the pharmacy, and you, and getting you pregnant. So that is why we put this program together, to try to help you through these questions. You can ask them now so that later on you don't have any questions because you're ready to go. You watch the pharmacist program, and that's what it's all about. So thank you to everyone who joined us via Zoom and Facebook Live, asking all of these excellent questions that you did tonight. We really do appreciate it. And we hope that you were able to learn something tonight as well with some of these great answers that you were able to hear from Karen. And as always, do not forget that all of these full virtual learning experiences, such as this one you're watching tonight, as well as those individual product demonstrations, the little shorter ones in the middle, are available on demand. You can find them on our YouTube page. You can find them on our Facebook page. And of course, you can find them on our homepage at mymandelsPharmacy.com/PharmAssist. And there you can choose to watch the full ones if you want to get all the question and answer involved as well. And they're all broken out by product. So you can search for the ones that have the product that you're looking for questions on, or you can just search by the product and just watch the video that Karen demonstrates how that works, as well as our many other nurses that you see as part of the program. So we definitely look forward to seeing you join us again, where we will bring up more different products, different questions and answers will be brought up into play. And that is every Monday night at 7 p.m. Eastern. And that's where you can find out all the different things that we talk about as well. We'll share some of our programs that are part of the PharmAssist program, like our Leaning on Sunshine, where we're there to support you through the difficult days that you may have. And when you have the questions and you really just need some support from somebody else going through it, our Leaning on Sunshine page is a great way to hear what some other people going through the process, such as yourself. You can check out our Behind the Shots, where we talk about some of the stories on why our great nurses like Karen got involved in fertility in the first place and why they're here to support you through it. So plenty of other information you can check out on the PharmAssist page and on every Monday night at 7 p.m. So with that all being said, the most important thing I can ask is if you found anything of value in this program, please, 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 we ask you to share this with a family member, a friend, a colleague, somebody going through this process that can benefit from it as much as you did. So please feel free to hit that share button and let somebody know, because that's the best way that somebody else can find out about the PharmAssist program. So thank you so much. Thank you, Karen, for everything tonight. Thank you, everybody at home who joined us. Thank you, everybody back at Mandel's who helped put this program together. And as Craig Orpello, I want to say on behalf of the PharmAssist program, have a great night, everyone. See you next Monday.